Hello, my name is Kate Ramsey. I am Senior Clinical Supervisor here at Retreat Behavioral Health in Lancaster County, Pennsylvania. Many of you have been wondering what we are doing to not only provide your loved ones with compassionate care, but to also keep them safe. A lot of what we have changed about our program is based on government guidelines. We have taken our large groups, which are normally 25 to 30 people, and we've broken them down into groups of 10 or less. This allows our patients to still get processing groups, psychoeducational groups, and be able to do so in a safer environment where they're able to keep 6 feet distance. Same with meal times. We've started rotating all of our meals so that each group has a half-hour slot where they can go and eat. During that time, they are seated at tables, but we've removed about half the chairs so that each table only has 4 chairs apiece, again, allowing for this safe distance. We do have a cleaning crew that goes through regularly, sanitizing and disinfecting the tables, hard surfaces, door handles, anything that people frequently touch. Furthermore, we are keeping sanitizing wipes everywhere. We do have alcohol-based hand sanitizers. The therapists are responsible for keeping this. We are treating it as a contraband substance because it does contain alcohol, but we do have our therapists start each group by giving a little squirt of sanitizer to each person before the group begins. We have tissues available to everyone. We encourage people and remind people to cough into their elbows and all of these other protocols that the government have put into place. Another thing we've had to take into consideration is the fact that some of our therapists have underlying conditions. We want them to be safe as well, so we have asked them to work out of the home. What does that mean in terms of your loved one's care if we don't have as many therapists on site? Well, we've assigned all of the offsite therapists to do documentation. Normally, documentation can take up to 50% of a therapist's day. By assigning all the documentation to therapists who are off-site, the therapists who are on-site have to focus solely on meeting individually and in very small groups with your loved ones. This means that even though the groups are smaller and there are less therapists, there's actually more therapy time that is happening every day. Another thing we've started doing is having full staff meetings in the morning and in the afternoon so that in the midst of all the information that is coming out and all of the updates that are happening, our team has the most current updates, the most current information, and they have an opportunity to ask questions and discuss concerns regarding patient care so that, again, they're giving the best care they can, but also the safest care they can. This ability to communicate and this time to communicate has proven to be incredibly helpful in streamlining care, as well as getting rid of any kind of myths that are roaming around and creating anxiety among our patients. One of the big concerns that families have is, do we have anybody with COVID on site? At the time of this videotaping, we are quote unquote COVID free. However, we are taking every possible precaution to make sure we remain that way. We have limited who is allowed to come into our facility. We do not accept people coming in on trains or on airplanes any longer. We also have a number of questions that our admissions team asks when a person first calls in to ask if they can be admitted to our facility. Once the person has cleared all of these questions and successfully completed the assessment, our drivers will be sent out to pick them up. When the drivers arrive, the first thing they do is take a temperature of a patient before the patient enters their van. Once the patient arrives at retreat, then they go through the same questionnaire again. They have a more thorough physical, and finally, if they have passed all of these hurdles, they are fully admitted into Retreat Behavioral Health. This allows us to really make sure that the patients we're bringing in do not have any signs or symptoms of COVID at the time of admission. A lot of families have also asked what would happen if it's my loved one who winds up with the COVID-19 virus. It's a really good question and one that we thought a lot about. We have an entire floor cleared in the event that we need to quarantine patients, and we will permit patients who are in quarantine to have access to their cell phones so they can reach out to family and friends whenever they want, as well as have access to iPads and other ways to entertain themselves, from puzzle books to regular books to coloring books to other kinds of art supplies. Basically, whatever we can find that will help them get through, we will provide them with. We will also make remote counseling accessible to them. So with their iPad, they can Skype or they can use 8x8 to join a group so that they don't miss out on treatment while they are still working on quarantine. A lot of family members are wondering, well, what if I want to visit? What if I want to bring gifts? What if I want to attend the family workshop? What if I want to pick up my loved ones so I can take them home when they're done their treatment? We are not having any visitation at this time. You can certainly Skype or FaceTime your loved one. We will make all accommodations for that. You can bring things on site, but you have to park, call into the front desk, and then some staff member will come out and collect the things you've brought and bring them into your loved one. If you want to attend the family workshop, you're going to have to do that online. We do have the head of our family workshops, Chris K., who is putting together a video that you can watch online so that you get all of the information that you would normally get in person. Lastly, if you do want to pick up the person you love and bring them home after treatment, again, come, park, call to the front desk, and then we will escort your loved one out so you can take him or her home. You know, all of this is to minimize the number of people on site, because the fewer people, the lower the risk of getting the virus on site. This also means that we've had to make some major changes in how we deal with things. Anybody who is not considered direct care, which is upper administration, patient care coordinators, utilization management, and on and on and on, are all working off-site. That includes our medical providers, with the exception of the head of our medical team, and our psychiatrists and psychologists. We've been working with telehealth. That is an excellent system for helping our psychologists, psychiatrists, and providers meet face-to-face, but at a distance, so that your loved ones get the treatment they need, but again, we minimize the contact with other people. In conclusion, we have had to make a lot of big changes and many small adjustments to make sure everybody is safe while receiving the treatment they need. Whether it's having lunches on shifts and taking half the chairs out of the cafeteria so that patients can't sit close together, or it's sending all non-essential personnel home and figuring out how we do this remotely, we are taking whatever steps are necessary to keep everyone healthy. This is not the end of this. There are surely more changes to come, but please know that we are dedicated and devoted to doing everything in our power to keeping our doors open so that your loved ones can continue to find recovery while also staying in good health. May you all be well. May you stay at home, shelter in place, and may we meet again on the other side of this pandemic. Thank you.